Hi everyone, I'm Harleen Kaur, and I'm a research assistant at Stanford University. In this video, we're going to talk about reproductive coercion, what it is, and how someone can get the help they need. Joining me is Adriana Garcia. Welcome.
Hi, I'm Adriana Garcia, and I am the Community Prevention Coordinator at Nextdoor Solutions to Domestic Violence. Before we begin, we have some disclaimers we would like to go over.
Given the sensitive nature of this topic, we recommend using the following additional safety steps if you might be at risk for intimate partner violence. 1. Find a safe and private space to listen. 2. Please use headphones to listen to this video. And 3. Pull up another website on the latest news or some random webpage so that you can easily change tabs if anyone approaches you during this video viewing.
Also, please remember that your internet history can be monitored, so please clear your browser history and your YouTube history after viewing this video. In the show notes below, there is a link to instructions on how to clear your browser and YouTube history, and a link to a news website to escape to if needed.
Let's have a quick chat before we move forward about some important disclaimers. While we will talk a lot about healthcare, this video series should not be used for personal medical advice. If you're worried about your own health, please talk to your doctor who knows you and your medical needs best.
In some videos, we may also talk about legal issues that have come up during the pandemic. Our aim will be to make you aware of these, but once again, you should talk to a lawyer if you have any legal concerns of your own.
And finally, we have no financial conflicts of interest to declare. Now let's get started. Today we will be talking about reproductive coercion.
We will cover what reproductive coercion is, what the consequences of reproductive coercion are, and how you can get help if you are feeling unsafe.
Right. So, what is reproductive coercion?
Coercion is defined by behaviors that aim to maintain control and power within a relationship. So, reproductive coercion is when these behaviors are related to decisions about reproductive health, including contraception and pregnancy. It is often associated with high rates of intimate partner violence, IPV. Most often, women are the victims of reproductive coercion, but men and individuals from the LGBTQ plus community can be victimized as well. Globally, women who are experiencing IPV are twice as likely to have a partner that refuses to use contraception and to report unintended pregnancies. They are also up to 3 times more likely to give birth between the ages of 10 to 19.
Okay, so reproductive coercion is when a partner takes direct control over decisions related to reproductive health. Now we have a general definition, and we know that it occurs throughout the world, especially in abusive relationships. My next question to you, Adriana, is what exactly does reproductive coercion look like? How do we identify it?
The first one I want to talk about is pressuring a partner to get pregnant against their will, also known as pregnancy pressure.
So, how can the person causing harm pressure their partner?
Well, they can refuse to use a condom or even negotiate the use of one. They can use emotional and verbal abuse to push for pregnancy even when the partner does not want to get pregnant. And they can even force a partner to have multiple pregnancies and births in a short time frame, which can lead to health issues for the partner who is pregnant and the baby. This can also make it difficult to leave the relationship because they may now rely on the partner who abuses for financial support.
That is a really difficult situation to put your partner in.
Yeah, it truly is. The person causing harm can also pressure a partner who is already pregnant by forcing them to either continue or terminate the pregnancy against their will.
I see. So, in what ways can the person causing harm make their partner keep or terminate a pregnancy against their will?
That's a good question. So, the person who causes harm can use threats to get their partner to go along with their wishes. They can threaten to cheat on the partner or out their partner's gender or sexual identity. They can also use physical violence or injure their partner in a way that causes a miscarriage. Beyond that, they can block access to family planning services and abortion services, or make the partner get an unwanted abortion.
It seems that in all these harmful behaviors, the person who causes harm really doesn't value their partner's will.
Yeah, and reproductive coercion behaviors can also involve sabotaging contraceptives and other birth control methods. These can include medications, condoms, and implants.
How can these be destroyed?
Well, the person who is causing harm can hide and throw out birth control pills and even remove IUDs, rings, or patches. They can intentionally break or poke holes in a condom or even remove the condom during sex. They can also refuse to withdraw during sex, forcing pregnancy against the partner's wishes.
So, reproductive coercion can take on many forms, like destroying birth control, pressuring a partner to get pregnant, and forcing a partner to keep or terminate a pregnancy against their will. And in each case, it undermines a partner's wishes, which is at the core of reproductive coercion.
Absolutely. And reproductive coercion can have some terrible consequences.
What are those consequences?
Well, for one, it can lead to unintended pregnancies. It can also result in repeat abortions with a greater rate of second trimester abortions. Women in abusive relationships that experience reproductive coercion also have a greater risk for sexually transmitted infections, STIs, like HIV or chlamydia. Additionally, women exposed to intimate partner violence are less likely to disclose an STI to a partner due to fear that their partner would get angry and hurt them.
I see. That can be a lot to deal with. How can someone get help if they feel like they're being coerced? Who can they turn to, and what kind of help can they get?
Your primary healthcare provider can be a great resource for help, and going to them won't typically raise a partner's suspicion compared to other sources of help, like a social worker or shelter advocate.
So, what can my primary care provider do for me?
Well, a number of things. For example, if you are worried about concealing birth control pills, you can ask your provider to give you the medication in a plain package rather than the larger box with bold labeling. Further, you can ask for more discreet and confidential methods of contraception instead of oral contraceptives. These can include emergency contraception, injections, and implants. And if you are worried about your partner monitoring your bleeding patterns or your cycle, an IUD can be a safer long term option because it won't cause menstruation to be absent.
Those seem like some good options. What if I have a positive sexually transmitted infection result and I'm afraid to tell my partner?
That's a great question. In such a case, your primary care provider can request for your partner to get an anonymous notification through services found in a local health department. In general, your provider can help get you information about safety planning, support services, and harm reduction strategies while maintaining it all completely confidential.
Thank you. It's really helpful to know that we can turn to our primary provider for support. I have another question. What if my partner accompanies me to the appointment with my primary care provider? How can I ask for help then?
That's a good question. In these cases, you can request that your provider talks to you privately in another room during the visit. If you are unable to ask for that, many practices will have numbers you can call for assistance in the bathroom or other places that you cannot be followed into.
Okay, that makes sense. But I'm worried that if I report abuse, it will show up on my medical records and my partner will see it.
That is a valid concern. If you are worried about anything like that, let your provider know, and they can use language that protects your privacy and is readily understandable only by other providers.
Thank you for that information. That makes me feel much better about talking to my provider.
Of course, we also want to take a moment to emphasize that any type of coercion or violence is not the fault of those experiencing it.
Yes, definitely. We are here to help provide information so that more people can become empowered to better understand their situation and know where to get help. With that said, let's wrap up by reviewing what we have talked about. First, we talked about reproductive coercion and how it impacts decisions on reproductive health. This can look like pressuring a partner to get pregnant against their wishes, forcing a partner to continue or terminate a pregnancy against their will, or sabotaging birth control methods.
We also learned that reproductive coercion can lead to unintended pregnancy, repeated abortions, and STIs. But there are ways to get help if you feel unsafe. You can turn to your primary care provider to discuss harm reduction strategies, safety planning, and other ways to reduce the risk associated with reproductive coercion.
This is really helpful information. Reproductive coercion can be a difficult topic to talk about, but we thank you so much for taking the time to learn with us. Goodbye for now.